Here are the latest hospitalization numbers. 274 COVID patients are in hospital beds in Hidalgo County. That is 17 more than we reported at 6 p.m. 19 are in ICU. Cameron County did not specify their current hospitalizations in tonight's report, but at last check, 205 COVID patients were hospitalized, 33 in ICU. Those numbers resulted in a new suspension order today, one that will affect those of you who don't have COVID but may need a medical procedure. Here's Channel 5's Christian Colon.
Governor Greg Abbott trying to address the issues of capacity. Now hospitals in Cameron and Hidalgo County can suspend elective surgeries and procedures, performing only those that are urgent.
Who best knows those patients than their physician here on the spot? And so we believe it's flexible enough to be able to make sure that we continue to hold beds for those COVID positive patients that need it, to evaluate and treat those patients, but allow us the flexibility to be able to make sure that we're able to provide health care for the rest of our community for the other important illnesses, heart attacks, strokes, cancers that cannot wait.
Chief Medical Officer for DHR Health, Robert Martinez, says if it's a critical non-COVID-19 patient, they will still be treated, such as trauma. But with the suspension, Martinez adds staff can now be transferred to work new COVID-19 units.
Where we were short, it's staff. And making sure that staff doesn't get burned out by reusing them at a high rate. Because this is a special illness, it's very taxing, requires a lot of time and patience.
Martinez says DHR Health has requested the state to send more staff, such as nurses, physicians, and techs. Likewise, at Valley Baptist in Harlingen, where today more than 60 medical staff showed up. As you see here in black scrubs, radiology techs, respiratory therapists arrived from out of the area to assist.
A lot of them all have served in New York City. And when we met them today, we told them, we definitely welcome them here. And we also would want to learn from them things they've seen in the East Coast pandemic, things they can bring here that we're not doing. We told them to be our eyes and ears.
Archie Drake, Chief Operating Officer at Valley Baptist, says they were forced to start cutting down on elective procedures last week because of the increase of patients. He says just today, around 70 staff members called out because of some sort of sickness. They're focused now COVID-19 patients and critical non-COVID related cases.
Mask, N95 mask, gowns, things like that, which we're using to protect our team as they're taking care of these patients. The county have gotten into resources where we're getting drops of that type of equipment on a fairly routine basis.
Drake says prioritizing procedures also helps in saving PPE. He adds they have depended on the county's help for extra supplies given to them by FEMA. In McAllen, Christian Colon, Channel 5 News at 10.
We saw the incredible spike over the past couple of weeks, both in the number of people testing positive as well as the hospitalizations and the positivity rate that I told you in advance that if the positivity rate got over 10%, I was going to have to take action.
And he did. The governor's ban on elective procedures is not statewide. It only applies to the counties highlighted on your screen. You can see it's mainly the areas where our most populated cities are located: Houston, San Antonio, Dallas, and Austin. The order doesn't apply to Tarrant County, which is the third largest county in the state. That's where Fort Worth is. Cameron, by the way, isn't even in the top 10.